Ayɛka sa mo de mo cost say 38%, pains, 38%. No problem. And I thank God say we the people that Ghanaians have voted for. No matter what you say, the dead ghost syndrome still applies. So sometimes you just ask yourself, is it even worth it coming out to come and say it to the hearing of Ghanaians? Because Ghanaians know what they were opting for. Bibiaa koto abama idisi biano. I mean, 18 years. Teacher say, John Mama 1.0 no. One now with the 18, you are around 12 years. 12 years akolano. I mean, if your light is going off, you should know that you are having doom so, and then what else? That there is heat in the room. So if not anything at all, if you cannot remember a year, the fact and all those things, at least you could remember that as a 12-year-old, there was no light for you to even learn. And some of these 12 years, 13-year-old were the ones who were writing BEC and John Mahama 1.0. So you should remember, say, you got your BEC Monday, Tuesday, no. You got your paper biom, not light neho. Until Monday, you use candle to learn. Some of these things you should be able to remember. But I mean, they all still went to vote. And then the I won't vote syndrome also, as I bear to say, ammonia, laughing gas. The I won't vote syndrome, no. Ammonia, laughing gas. And see, I don't know how they were able to spread it all across the nation at once. Everybody inhaled it. I won't vote, I won't vote, I won't vote, I won't vote. And I won't vote, I won't vote, I won't vote. The I won't vote has happened to all of us. Now who cause them? So now who cause them? We all cause them. No be so. So we will all live in it. Ebusianfo, let me start with Mita Akando. Minta Akando, aka Danny Hall Prefect. Minta Akando see they have been able to restore patient data. Minta Akando see they have been able to restore patient data using data from National Health Insurance. And this was well captured by Joy News, I believe. I want to bring it to you so that you see that I'm not lying. Akando said that, said patient data, they have been able to retrieve it. How did they retrieve it? Through good desire. So this is it. Minta Akando, Air and Run News. Or see, LHIMS saga. We have reconstructed not less than 16 million patients' data from the National Health Insurance to ensure patient data is not lost. Akando. I read again. We have reconstructed. Now, Oba health my if I be reconstructive surgery. Let's say for instance, bibiaa, and then unfortunately for you, you have lost maybe the flesh on one side of your face. And the surgeon said, if you should leave your face like that, no, you will not be able to even live it yourself. We can do reconstructive surgery, and we can pick your skin. We call it drafting, yeah. So we can pick your skin, maybe from your ass, your buttocks. You peel off the skin on your buttocks, and then we use down to cover the part of your face that is exposed. That is called reconstructive surgery, right? There are times that for some procedures that they need more skin, they are able to dilate even the skin of the forehead. Okay, they are able to dilate it so that we can cut some off, the excess off after some time, to put wherever, to patch wherever it is. And Akando say, Ghanaians, anybody who requires a health assistance or your hospitals, your patients, they should not be worried. Don't be worried. Esan say, Himita Akando, leading Ministry of Health, they have been able to reconstruct not less than 16 million patient data from the National Health Insurance. Now, when I saw this, I realized, number one, and I say, Ghana and Kasano, you have a big problem. We have a serious problem. And this problem that we have, sometimes I tend to forgive common floor members. Bankrofoɔ a mo from who journalists. Journalists for I expect most of the time say they will do better. So Joy News is telling us, say, it is true. The minister has said this. But what does Joy News know about what the minister is saying? You don't have any view about it. See, last year, 2024, almost all these media houses that today we are seeing that they are coming up with uniform, titles and captions. Almost all of them last year, they turned themselves into fact checkers. Akufo-Addo Kasia, they come and sit down, say you almost fact check it. Bawumia Kasia, they come and sit down, almost fact check it. Then they will leave NDC and their cohorts to say whatever, to spew whatever they want to spew and go away with. So I was thinking, say, okay, per the Ghanaian media analogy, you only fact check the government that is in power. If indeed it is that you only fact check the government that is in power, then Ayɛka government that is in power is NDC. And it's a NDC for, and I say government appointees, ye taxes etiom. The media owes it a duty to go and say, see whether the minister is saying is true or not. Number one, and he said, what is expected a year of national health insurance? Say, health insurance as we have it, it does not keep what we can term as patient data. Our health insurance, it does not keep what we call patient data. Let me explain to you. People, they are afraid chronic disease. And acute disease. Acute disease, wait me afraid baby say malaria. Started and chair. Auntie started feeling feverish first day. Second day na call hospital. Second day na yama odro. By 6th day now bibiaa fine. Acute condition no. Obinsu ni yare no chronic. Ewo ho till thy kingdom come. Ebia hypertension. Or you see nipa no BP. Obi or BP you don't treat it once. Our man I say there be. So the person has to repeatedly keep coming for their medication until thy kingdom come. Yare pe bre wo chronic conditions. Now, Mita Kando say, uko hospital. Now, ebia a dry trauma it is covered by health insurance. Health insurance has to keep a record of that medication. Ebia, udi malaria nebai. And we gave you diclofenac for pain. Now, sa diclofenac ayede ma covered by health insurance. And that hospital has to keep a record, say, Yema, ebia the voice of MPP diclofenac, so the government can pay them back. How do you use this as a way of reconstructing patient data? Minta Kando, what is wrong with you, Mr. Minister? I don't get it. How do you tell me this story? Now let's take for instance, say, a drobit is say, diclofenac can make one sem, a year for pain. How are you able to tell, say, the pain is in the chest, the pain is in the mind or the head, the pain is in the leg, the pain is in the thigh? How are you able to trace it? How are you going to trace that to tell me, say, you have used national health insurance to reconstruct patient data? Mita Kando. Mita Kando. You have to get serious, Mr. Minister, Honorable Minister. You must get serious. Let's say Obiba Hospital, and I try their caps tramadol 50 milligram money panu say onkoto, and I say the person needs it, the person requires it. Right? Now, ebia sa caps tramadol 50 milligram no, captured by health insurance. So they keep it say okay, so and so was given a caps tramadol 50 milligram at this point in time. How are you going to use that, say, because caps tramadol is for pain, no? And a pain, no? A broken bone, and I say fractured something, and I say a muscular tear or something. There is no way you can tell that. And it's a Obiba Hospital now, maybe a one-time diagnosis, sir. How do you use that to tell me, say, you have used that data to reconstruct the person's health history? What Minta Kando does not want to admit, ni say, a lot of Ghanaians are dying as we are speaking. And they are not dying of hunger. And yes, come ne kuomu. And yes, dumso ne kuomu. And yes, eja ne kuomu. Omu history, medical history, no. And ni hobium adentia Minta Kando has single-handedly abrogated contract that was between the government of Ghana and a private contractor that was keeping our medical records. Now, when he was going to abrogate the contract, no, wanyenu nyasankwem debi okoyenu buga buga. And chokoyenu buga buga no nipa. And as Crawford, your company now, or more medical records, no. Almost say, okay, say, obey no giddy there. He and fat data I will mouth. And one no know. This is all that happened. And I say, this is all Mita Kando does not want to tell you. It was possible, say, Mita Kando, a health minister, no, he could have gotten back the data. Whatever data was on the LHIMS, and Crawford health history. Say okay, we stay say and say no, our BP. Now our BP, no, ebia normal saline. You don't have to give him normal saline. You give him the other one. And I say, wait, don't give this one to him. You give this one. All those ones, no. Those records are records for over 6 years. Records for the past 6 years. Mita Kando, because on him diplomacy. Mita Kando, on him diplomacy, he has succeeded in messing it up. And can we are very diplomatic and we are good planner. Unem say, Ebia Papa we no, and I say Crawford we no. I don't want to renew the contract with them again. You start planning ahead. Eka 3 months, sir. Wow, unem say, okay, after 3 months, me renew my contract so. But data no ewo mo. So how do you get the data? You become friendly to them. Then you start telling Ebia IT4 or more hospitals and say, start creating a backup of all the patient data at the various facilities. We all microphone who there be when you say 3 months and who person was saying, yes sir. So every hospital will start creating a backup. So by the time the people realize you have your own set of patient data backup, then you can come and tell them, say, okay, say that your person has a new contract, no bill. That way you have been tactile. Who use you again. But who sorry preoccupation there be togbe mupo me renew contract mamu bill. And you see, if there to be some nations, or might be more, Minta Akando should have resigned by now. Because over 20 million Ghanaians, your health history is lost. Now, sometimes you don't understand the danger. It is so dangerous, say, even those records that some of us were using to conduct research at the postgraduate level, some of this research, now we were looking at a drofu froy, but me they treat some sicknesses and others. All those data, aira, any obium, and we have to start from scratch. Now it's not the starting from scratch. No. Now okonya data no one. Today, how are you able to tell, say, ABR 70,000 Ghanaians were responding well to ABR an anti-malaria drug? Honorable Cook says that the minister has lost focus. I agree with you, Honorable. Thanks for the gift. How are you able to tell today, say, this number of Ghanaians are suffering from ABR anxiety disorders? How are you able to tell, say, this number of Ghanaians are suffering from PTSD? There is no way to tell now because Minta Akando has single-handedly abrogated a contract without knowing anything about it. Now, Yemubi, Munim say, because my work is at a hospital, I have a lot of friends who are on the ward, doctors, pharmacists, nurses, med lab technicians, biochemists and all, medical biologists and the others. And all of them will tell you, say, software Minta Akando today is trying to push down all of us our throat. Games, software, nothing is in it. Last time, Migabe, sit for almost 18 hours, or IT guy, 18 hours, he could not leave work. Almost every 15 minutes. That games, it break it down. Games, Minta Akando, say a replacement for LHIMS, almost every 15 minutes, it break it down. It just reminds me of that funny saying that we say that I know someone who can do it at a cheaper rate. So okoto adebi ade papa bi na obi ka say oh en fa wo sika yin na koto ade we I mean obi obet me aton ama o cheap. What I ordered versus what I got. That is what games is now. And you should be worried. Say Minta Akando is telling you and I say the data they are going to rely on is your health insurance. And why only health insurance here? Now you are safe. Me, I'm telling you. Take it from me as my medical advice to you. If you don't have if you didn't have a health insurance, if you did not have health insurance, you are safe because at least we over hospital, we will have the time and the patience to diagnose you. Ebia waba, because I don't have your data from LHIMS, and may need any misleading data so in the health insurance data. I can sit down, conduct all the tests I will want to conduct, and then diagnose you at fresh. But se oko fasa Minta Akando, Ghanafuɔ, we are in trouble. Oko fasa Minta Akando, health insurance data now. You see, the human mind is such a way that we become fixated on things. And to uba minchen, na say me diagnose you. Na me tell me say, there be on your health insurance no, ade ayetro wo ho, ebia typhoid. The last time I treated you were typhoid. I will keep querying for typhoid. But ebia enye typhoid asemu. So by the time I come and discover, I said there be any typhoid, I feel for a peptic ulcer, and I say a duodenal ulcer. Oh, now we will cry. Now I'm quite so I could say oko mortuary. That is what Minta Akando is doing, And I'm surprised, say, we have CSOs in this nation and they are all quiet. The so-called CSOs who were on the neck of the former health minister, the first one that was appointed by Akufo-Addo. CSOs for no. I'm so much surprised that they are today, now they have become what we call in French aveugle sous muet. Aveugle sous muet. All of them, the so-called CSOs, all of them have become aveugle sous muet. French. In English, it means deaf, dumb, and blind. Aveugle sous muet. That's French. The so-called CSOs. And the some news item say they have reconstructed patient data. No doctor is going to rely on this. No pharmacist is going to rely on this. Surely no specialist is going to rely on this. He knows what he has done to this country. He knows. The minister, he knows. That is why he's trying as much as possible to create a better narrative, to make it look like, oh, it is not too much of a big deal. But I want him to say a big deal. And because of what he has done, there are a lot of fundings I have free and neighbor for some interventions in the hospital. Emba, it will not come. Mbekaya almost every year, your partners be more free US, Germany, UK, our medical teams free hernia repair. Hernia. Have you heard of that? Say they are doing any free hernia repair anywhere in this country. They cannot add entire patient data no. Because some of these surgeries, you need to get the people like 3 months, 4 months before, and then trace them, take them through a routine before the surgery day. So you see the number of people who have had herniorrhaphy. Herniorrhaphy means hernia repair. Surgical term. Say those of you who are not having any health background, at least you are learning one thing or two. Clap for me. Clap for me in the comment section. I'm sharing some knowledge with you. And herniorrhaphy, they will have benefited of it for free. This year, nothing like that because minta candle. They also used to do goiter repair. This year, I've not heard of any. Why? Because there is no patient data. And this is what Mita Akan does not want you to hear. But now who cause them? Now kwen cause them. By now, we'll be able to say, zipline, drone delivery in there. Attention. And again, a Minta Kando effect. Now, Minister Nko Kana Entia, or see, Teresa says so sad. Minister of Health is telling us, he doesn't understand why drone is used to transport condoms. Yantini you. Or see, or no Minta Kando no. For him or to him, no, a misplaced priority say, the drone at transporting condom to some places, and that is why him cannot have decided say on renew, and that's they will break down the work of zipline. Ebusiamfo. Earlier this year, Mbekachiremu say, depot a family planning 3 months there. 3 months depot. Na under Akufo-Addo, sometimes cry a dose to the extent say a bit me expired a touch unikrano. Earlier this year, a shorty. Now said depot shorty a family planning medication, a shorty. What is the next thing people will tend to? Condoms. by using condoms or by giving condoms to your population, and that's your people, you are helping prevent unwanted pregnancies. Those unwanted pregnancies, a burden on the health system of the nation. Say, mental kind of nima. A burden on the health system of the nation, because there are some vaccinations. You vaccinated newly born babies that are on the cost is borne by the state. And when you prevent all these unwanted pregnancies and babies and all those things, you are saving the country money, which money maybe you can use to develop a certain part of the nation. But you see, when you have people who are short-sighted, they cannot think beyond what they will get in return. They start making some of these choices. The only reason they are doing all of this, and they say, and you're award contract, they say 1% almost award contract, for no 10% or cut. And one no. And whilst they are doing this, instead of all of us to come together and say, no way, this is not the way to rule or govern a nation. A bad precedent. Said because of why 10%, because of why chobonti, people should die. Their health record should get missing. Zipline drone that was sending anti-snake serum and all those to places that are hard to reach, because of your parochial interest, all those people should be left stranded. You are now doing MPP4, 38%. Mpaucho, we are in our hospital. Obian bisa o party. We are in our hospital. Obian bisa o party. God forbid, but when you are involved in an accident, now you rush to call hospital. Now with blood group type, the blood bank of that hospital does not have that blood group type in store. Now you see, we can only get it from Kolebu. But also, you are in Kumasi. I say you are in Ho. And you need blood urgently. That is when you will know what Mintakano has done. And Ayɛka, more than more say 38%, pains, 38%. No problem. And I thank God, say, wait a minute,